Hello and welcome back to the Aesthetic Dialogues. In this series, I am interviewing various aesthetic experts across our country who have been into practice since last 15 to 20 years. So the guest for the today's episode is Dr. Reema Arora today, and she is an international trainer for fillers and Botox. She has trained over 2,500 dermatologists and plastic surgeons over the last 18 years. She's a prominent key opinion leader for a few major names of the industry. Dr. Reema Arora is extremely skilled in carrying out high precision non surgical procedures like nose shaping, enhancing thin lips, elongating the chin, jawline definition, cheek enhancement, etc. Dr. Reema is also the founder of the Face Clinic, which offers the finest aesthetic and smartly aging treatments using the latest techniques. Under the guidance of the best rejuvenation expert, an ethical blend of skill and technology is employed at the Face Clinic to deliver the highest level of skincare service and treatment standards. She also has many publications to her name and has been a faculty to many national and international aesthetic conferences like IMCAS Paris, Dermacon, ASICON, etc. So without any further delay, let's get into this. Hi, Dr. Reema. Welcome to the Aesthetic Dialogues. And I am so happy to share this platform with you and gain your insights.
It's my pleasure. Thank you so much for having me. And it's so wonderful to see you after a long time, even though it's virtual, but we haven't met in a long time.
Yeah. So the first, the first I remember meeting you was like long, dear. It was my first training with Allergan. That was the time I met you. So it's been long since then.
Yes.
So are you ready for your questions?
Yeah, sure. Whatever you wish to ask.
So now my first question is that, you've had an elaborate and expansive career over many years. And you started when very few people were acquainted with the term medical facial aesthetics. So how did you, get started? How did you start your journey at that time?
So this is really interesting because I feel that it's sort of like an individual's destiny that takes you there. So it was way back in 2006 when I started working with Allergan. And my role was I was the medical head for Allergan, and I was involved with meeting a lot of doctors, doing a lot of trainings, and in all those interactions, it was really stimulating, and it really, motivated me to go into aesthetics. Then there was a lot of learning in different countries like Singapore, Korea, and Australia, and all that learnings put together, I was really ignited to do something in facial aesthetics. And so here I am since 2006, this journey started. And I love mixing the science with the art and giving innovative solutions for facial aesthetics. So I love it.
So that is the injectables was something that made a turning point in your career, basically.
Definitely, because I was totally into a career of pediatrics, and then because we were dealing with spasticities, and that's how I got involved with Allergan.
Okay.
And it all changed after that.
Changed after that. Great, wonderful. So now there is a lot of confusion that exists in the medical facial aesthetic space. Also, the practitioners are practicing predominantly what they, resonate with the most. Some are more into injectables, some are more into the laser and light devices. So some are predominantly, into their peelings and body resurfacing zone. So choosing a right practitioner is a very big challenge for someone who wants to pursue these treatments. So if one has to design a flow chart on how to choose the most appropriate practitioner for themselves, so what would the sequence be like?
So that's an interesting question, because sometimes when a patient walks in, you can understand that they're in the dilemma because there are many options available. And I feel if I were in their place, the best way to start is to first understand what the doctor's education is, what sort of certifications they have, what qualifications are there, how many years of experience do they have. That's a good way to start. Definitely going and reading their reviews, seeing what other patients have to say about them can be nice. And definitely I suggest that you can book a consultation with the doctor, see how your assessment is done, and then what is your rapport that you've built with the consultation. Definitely you'll understand if you're comfortable or not with them, understand where they're practicing and what sort of modalities they use. And in the conversation, you can understand how good they are with the techniques and what sort of innovation they're using. Since facial aesthetics is so fast in progress, I
Yes.
feel we all have to keep ourselves up to pace. And whenever you're deciding on a treatment, you should ensure that the practitioner is actually constantly educating themselves and has gained an expertise in whatever field they wish to go by. Even if it's to do a hair removal laser, once they do a consultation, they can understand how much the doctor knows and how much they're open to discuss. Definitely, if they feel that they're getting pushed to do a treatment, then that's probably not the best place to be.
The best. It's very true. Right. So, wow, that's a wonderful answer. Now, let's reverse the question. If the doctor has to choose the right patient for themselves, what are the red flags that you would see in a person, because there are certain people you resonate with you and your technology is best. And then there are certain who don't. So is it a way to find out? Is there a way to find out? Or, I mean, through experience, if you have.
That's even till today, it's a very slippery ground, because often you get in a catch 22. Should I be treating this patient, or should I just let them go? I've always told during all my training sessions with all physicians is that medical aesthetics is as serious a specialty as anything else we practice. So it's very important to start at the beginning, wherein you're doing your history taking, understanding what's the concern of the patient. Secondly, understanding what is their motivation, why are they in your clinic, and then whether you would be able to deliver what they are expecting. If you feel that their expectations are there and you're here, it's better to let them go and tell them that you're not in the right place. So discuss the treatment. Also discuss what are the possible complications that may happen with the treatment. As a physician, we should definitely discuss it with the patient. Give them an insight of the ethics behind every treatment. Like, there is only a certain extent and you shouldn't bend. So you should be very clear that this is what is ethically possible and we cannot do other things for you. Also understand whether they are understanding the post-care, the possibility of a complication, that they need to follow up with you, and that it's an ongoing process. It's not like bang, everything is just going to go away.
It's not a one-shot thing. It's like a process.
Yeah, totally. So because people are having so much knowledge out there, and some of it is half cooked. So people are reading social media, or they're doing TikTok, or they're doing. Sometimes Google can be quite irritation for the doctor, because the patient will come across as if they have read everything and they know everything.
Yes.
And if I feel that, in my personal opinion, if I feel that I'm not able to get my point across to them, then I usually defer the treatment, or I straight away say no, that I don't think I'm the right doctor for you. So it's not only for, if somebody comes for clinical dermatology, I'll tell them I'm not the right doctor for you. You need to see another person. Or similarly, if somebody's got really big lips and they want more product, I will say, sorry, I'm not the right person. I would counsel them, and then if they don't understand, I would just, politely say, it's not a good idea. And the biggest red flag for me is if they come into my clinic and they talk about my colleagues and they're saying things which are not acceptable, or they are sort of criticizing or commenting too much on the work on a colleague of mine, then I know there are strong red flags and they're not going to be easy to please.
Yeah, and that is something very common, because they try to gain your confidence and then bargain on that later.
Yes. I
Mm.
remember in a conference when I was attending with Dr. Arthur Swift, he has this slide where they show that the patient is hypnotizing the doctor and saying, fill my lines, fill my lines, fill my
Yeah,
lines. And
yeah.
the doctor sort of gets carried away because they're like so
Yeah,
overwhelmed by the pressure of the patient.
right.
I think that's the main thing that you have to understand, that at the end of the day, you're the doctor. And if you feel you cannot give a result or they're not the ideal candidates, you should just say no.
Yeah. So this saying no component has been, constantly resurfacing in all my interviews with the aesthetic practitioners. That has
Yes,
been a really
because we're
one
in a
constant.
very vulnerable time, because
Yes.
there's so much happening. It's a very dynamic field.
Hmm.
There are a lot of options. So to all my fellow doctors who practice aesthetics, I feel that there are enough and more patients for all of us.
Yeah.
You needn't say yes because you have the pressure that I'm going to lose this patient.
Yeah.
Because in the long run, it's only going to be difficult for you.
Difficult. Definitely.
Yeah.
That's what we have to foresee at that
Yes,
time.
yes. And I think it comes with time and maturity, the
Comes
more
with time.
experience you have. Yeah.
Yeah. Right. Right. Wow. Now, most of the procedures that we do are mostly pertaining to the women, especially in the age group where they are, going through multiple dimensions of changes in their life. They are in the perimenopausal or menopausal age group, and their skin is going through multitude of changes, and their body is going through multitude of changes. So, how do these changes alter the treatment plans that you design for them?
Well, so now this is very close to my heart because that's where I am in my life. So I can understand
That is my
what,
zone.
yeah, what we're going through.
Yeah.
Um, there are many dimensions to this age group. One is, of course, they have more time on hand. Their children are usually settled. Financially, they're okay, so they have some time to spend and they have some budget to spend on themselves. At the same time, they have a lot of challenges. So their skin is not what it used to be. Pigmentation is a big issue. Suddenly, a very oily skin is becoming dry. So, as per their hormonal changes, we have to definitely modify treatments. Um, I try to avoid a lot of very heat related therapies because they're already going through the hot flashes, and not too much of aggressive lasers because pigmentation can get worse during menopause. I encourage more of relaxation therapies, a lot of body contouring because suddenly you're bulging from areas
Yeah.
which you weren't
Sure.
before, um, and giving them a very long term sort of regime. It's really gratifying because they start opening up as your patient, and somewhere we are all losing that confidence that now I'm going towards the other side of the spectrum. So these treatments actually really help to build their confidence, and it makes me very happy. And it's a journey. Every woman has to be told that menopause is not just one time. It's a
Right.
journey, and you have to slowly embrace it. And
Hmm.
I tell all my menopausal patients or perimenopausal is enjoy your menopause. There's
Yeah.
so many good things about it.
About.
That you don't have to worry about what you have to wear. You don't have to worry about contraception. You don't have to worry about I can't wear white today, or I have to carry my sanitary pad all the time. So there are
Right.
a lot of good things also.
Things also,
um,
yes.
yeah, and because people's expectations from how you look come down, even a little makes you look really stunning. So
Yeah. Wonderful. That's great. Also, one thing which I wanted to ask myself was that usually these women have this issue of puffiness, facial puffiness.
yes.
So, how do you design the facial fillers, keeping that aspect in consideration?
That's a wonderful question. One thing is that I start combining a little bit of energy based, like doing an ul therapy or a haifu to
Right.
debulk the face. I definitely add on a lot of lymphatic drainage massages to their treatments in the face, which
Yeah.
is relaxation as well as it does help to reduce the edema. I put them through the lymphatic drainage massages also, and I bring down the amount of filler that I'm doing before.
Right.
One rule I've really seen works very well is that the central face I start omitting, because anywhere there's more puffiness around the
Uh,
eye and the
yeah,
cheek
especially
area. So I work more on lateral
natural aspect.
lifting and giving them stronger jaw lines and a better chin
Yeah,
rather than focusing on their cheeks.
cheek.
That works well. And so if I were doing 4 ml for that woman, I would bring it down to 2. I do very minimalistic and
Yeah,
very natural, so nobody knows, but they look really fantastic.
wonderful. Lovely answer. Now, we have individuals opting for Botox from, say early 20s till late 40s and 50s. So, what is the age group that you have observed adapts well to Botox treatments? And what could be the possible reason for it?
It's really interesting the way our industry is progressing. We have more people coming in their 20s, sometimes even the late teenage adolescents want to get stuff done. I think 20 to 40 is most responsive to Botox. Uh, in the mid to late 20s, they're a little more of preventative or they want to reshape. So that's great because they're aware much more. And I think they're really smart. They know that if they start now, they will age better. So yeah, the 20s to 40s are the best. In the 35, 40, because they have more elasticity of their skin, their muscles are more stronger, they get brilliant results. And they don't have much of the static lines, they're
Yeah,
more the dynamic lines.
yeah.
So 20 to 40 is the age group where I feel they do the best with just
Because the
Botox.
changes are still progressing. They haven't yet settled down.
Yeah, yeah, and like I said, they're very smart because they're, what we call into preventive aging, which is, and I like this generation because they're very open and they're okay to accept. And
Yeah,
sometimes they even come into the clinic and say, "Doctor, I want Botox because I don't want to get permanent frown lines. My mom has them, or
yeah,
my
yeah.
aunt has them, and I don't
Yeah.
want them." So
Also, I feel that they are fast decision makers, because
yeah, yeah, yeah.
they decide
Yes.
immediately.
Yeah, I think the other thing is they have more disposable income, and I think in the times when there was only a one child, so there's one child or children in the family, so they have more money to do stuff as compared to older times where it was a larger family. So
Right.
people were more conservative on spending on themselves, so they're very self-aware and they understand that if they spend on themselves now, they're buying a lot of time for the later. So that's great.
Great. So how would you say that aesthetics is an investment? How do you come across with this point in your consultations?
Yeah, so post COVID, it's become quite easy because really people have realized that finally your body and you are what is actually yours. Everything else is very dynamic. And the more you're taking care of yourself now, you can fight, disease or illness. I think what I do is I tell them about how I myself invest in myself, in my skin, and um, compared to 10 years before to now, I feel my skin is doing much better. So that's an investment. And giving examples of how women who take care of themselves versus the ones who don't at the same age look quite different. How it impacts their personal life or their professional opportunities, because it gives a lot of self confidence, the way you look. Um, Unfortunately, even now, the first impression is how you see a person.
Yeah,
Even if it doesn't change a lot in the way you appear, I think it really works on your confidence. So I feel that it's a great investment for future for anybody.
right. And nowadays, there's a very big misconception that people have is that if they stop taking treatments, they might start looking much older. So, how is it that you manage this kind of misconceptions?
Yeah, it's okay to have misconceptions. I feel when we have those discussions, in fact, it helps to build a nice rapport with your patient. Um, and I'm very open to talk about all the misconceptions. What they need to understand is that whatever face treatments or aesthetic treatments we do, one, we will continue to age. So
Yeah.
that doesn't stop. We need to educate them that um, aesthetic treatments is only a part of how you're going to age. Your skincare is as important. aesthetic treatments are buying you time because
Yeah.
they're actually, like for Botox, I tell them that your muscles have gone on a holiday, they will come back after 4 months, so they'll be more fresh than where you started.
Right.
And similarly, all the treatments we do for face treatments or fillers, we're actually promoting collagen neogenesis. So the quality of the skin over time is actually going to improve.
Yeah.
And then I always educate them. I've got two types of patients. So there are some who are coming because there's a wedding in the family, or it's their 50th birthday or 25th wedding anniversary, and they have saved up that money to do something fantastic for themselves. And then there's a group who's the regular patient.
Mm-hmm.
Interestingly, the person who's like saved up and comes only once a year still looks much better to when they came the first time to the second or third time that they come. So there is definitely some longevity that you're giving your skin. So
Yeah.
that's a myth if you think that it's going to make you age worse.
So, and that your analogy is very good. Your muscles have gone on a holiday. And I usually say that it's like putting a pause button on your aging, till
Yes.
you're taking these treatments. And once you stop them, the pause button is off. So something like that.
Yeah, another interesting thing I heard from Dr. K.M. Kapoor at one of the conferences is he said that between the ages of 45 and 50, there comes this 1 year where you suddenly age more, and it happens to everybody.
Yes,
So
yes.
we should be open that there will be, like, if suddenly there's a stress in a family or you've gone through some illness, it will impact your skin also. And we have to just, accept it.
Accept it.
It's
The changes are
something we
going to
have
be
to,
coming. Yeah, we have to embrace those changes also.
yeah, exactly.
And no aesthetic treatments guarantees the way. I mean, you'll keep looking the way you are looking right now.
Yeah, exactly. So it's not surgery. We are just going to be doing some tweaking. Yeah.
Right. So now, so you have such lovely skin and no sagging and a very good jawline. So what is your favorite treatment that you keep getting done regularly, if you want to disclose?
Yeah, I'll very happily share. So definitely I have a good skincare regime in place, which I wouldn't have had unless I was in this field. I love doing face treatments, which are usually a combination of a laser and some infusions. Maybe once a month I do that. And definitely Botox filler once a year. So I don't do a lot of it, but once a year, yes, because I feel that that really helps with quality of skin and helps with the lifting.
Right.
Yeah, and that's
Okay.
all.
Great. So we know your secret recipe now. So basically, it's a combination of both injectables and energy-based
Face
devices.
treatment and skincare, all three put together.
Right. That works best. Okay, now being a medical aesthetic practitioner, what is the one good habit and one not a bad habit, but one habit that have acquired
Yes.
over the years? I think you understand what I mean to say.
Yes. Yes. So good is yes, like I said, skin, at least I have a skincare regime. So however tired I am at night, at least I will put something, even if it's not all the steps, but yes, sunscreen I've started using, which I wouldn't have probably if I
Other,
wasn't,
yeah,
otherwise I was the most happy-go-lucky person. And bad, I don't know bad, but I become very critical because we have,
yes.
okay, I think this is due, that is due. So over the years, balancing what you have and what you need to accept
Yeah,
has been what is my mantra to stay sane is, okay, I'm happy because I have all this. There's so much that I don't have, but
yeah,
yeah, let's accept that I'm X number of years old, so that's okay. So
that's
that balance is what is, yeah, very important.
right. Great. Now, one most overrated and most underrated treatment in medical facial aesthetics as of today.
For me, definitely underrated is microneedling. I
Okay,
feel it's a wonderful technology because there are many people
absolutely.
who don't want to go under the knife. There are many people who don't want to do injections.
Right.
Then I feel I love this treatment because it helps with texture. It helps with, you can infuse a lot of the good stuff into your skin. It helps with pigmentation, collagen neogenesis. So
Yeah.
it's lovely. I think most people who are regular in my clinic have microneedling of some form of the or the other. So that's underrated. You can really do a lot with that. Overrated, I think, is overfilled faces.
Yeah, that is
Fillers are
overrated.
they're great. I love fillers. Yet it's like it's the hands that are very important.
Yes.
Who's doing your treatment? As doctors, it's our responsibility to tell our patient stop. Many a times the patient will keep telling you, no doc, I need some more.
Right.
You should just tell them stop, because some of the not so nice looking people are becoming very bad advocates for our
Yeah,
profession. And I
profession.
don't want to look like XYZ,
Right.
including people from Hollywood. They'll
Yeah,
bring, see, she used to look like this, now she looks like that. So
right, right. So you
that's
don't
the
know their
overrated.
journey, their preferences, their journey, what are their, so that should not be there, I guess.
Yeah.
Okay, great. And one last question, that if someone who is beginning their career as a practitioner in aesthetics, what
Yeah.
would be your advice to them?
Yeah, so aesthetics is a wonderful field. What I feel is, ensure that you're getting all the knowledge first. So don't be in a hurry to start a practice. I feel you spend more time in educating yourself, because there is no stipulated course where you can learn. So you have to pick up bits and pieces, attend some conferences, um, do some courses. That's one. Second is, it's nice to work with somebody who's already in the field, so
Yeah,
that you understand the nuances of doing a practice.
right.
Because sometimes
Very true.
you may be excellent with your skill. You
Skill.
may be wow with anatomy, you may know everything.
Mhm.
You don't know how to deal with patients. It's a total different ball game.
Exactly.
Often,
Very true.
it's like you must have done a fantastic treatment, but the patient is just not convinced,
Yeah,
because a lot of it goes into how you consult with your patient.
yeah,
That is very important. Secondly, is my very strong advice is, don't do an injectable treatment the first time you see a patient.
exactly. Very true. That is something I totally agree.
Don't be afraid. If they don't want,
Mm.
if they will go to somebody else, let them go to somebody else.
Mm.
It will win you a lot of confidence with your
Mm.
patient, because they understand you're not in a hurry to
Hari,
just
yes.
inject and get away with, get the money back. Um, because aesthetics is a very long-term relation. If you're doing good, you will have a pool of patients who are happy to keep coming back to you.
Yes, yes.
And if you're losing your existing patients, that means there is something which you're not doing right.
Which you're not doing right. Exactly. That self-analysis is very important
Yeah.
and very true. Very rightly said. That was
And
golden nugget.
second, don't stop learning.
Yeah.
Irrespective of how many years you're into the practice, you have to keep improving. So my husband always says, the motto should be that I'm going to improve myself 1% every day.
Every day.
Um,
Absolutely.
and I think that is really good. It doesn't matter how old you are or what you're doing or what field of life you are in. That motivation is essential. And there will be good days, there will be bad days.
Yes.
You should have done something, some good learning that day, whether you had enough patience or you didn't,
Yeah.
you had a complication you had to handle. It doesn't matter. As long as you're doing something, improving yourself, professionally, personally, whatever.
Absolutely. Wonderful. So it was lovely having you here and hearing from you the insights that you gave. And I'm really thankful to you for your time. So thank you and take care and good day.
Yeah. Thanks for having me, and hope to see you soon.
Bye. Sure.
Yeah. Bye.
Thanks. Bye.